Dear viewers, welcome back from this report. We have been joined by our first guest for this evening, Dr. Abdullah Habib, Doctor of Psychiatry. Good evening, Dr. Abdullah. Welcome back to Hala, Kuwait.
Good evening, Rita. Nice to see you again. Nice to be here again. And hopefully today we'll have a very good conversation.
We always do, and it's very good to see you again, of course. And this evening, we're not talking about a certain mental condition like we usually do.
Yeah.
We're talking about a new device. I don't know if I could call it that.
Yeah.
Which is TMS.
Yes.
What is TMS?
So TMS stands for transcranial magnetic stimulation. That difficult first word.
Yes,
means,
that I refuse to say.
Yeah, it means it's through the skull. Mm-hmm. And basically what this device is, it's a device that has a stimulator and has a coil, and it sends magnetic pulses, not electric pulses, magnetic ones, like an MRI machine. Mm-hmm. We put it into regions of the brain that we know are associated with certain mental health conditions like depression, anxiety, OCD, mm-hmm. and we use the same frequency that the neurons, the brain cells, use to communicate with each other.
Nice.
And we force the brain to start, for a lack of a better term, behaving itself. Yeah,
That's
to start
amazing.
working the way that it should be working. Mm-hmm. And the brain feels that it's self-repairing because it's using the same frequency. So when we send these pulses over a certain period of time, during a certain amount of duration of a session, it's like taking your brain to the gym. You train it how to start working in the way that we need it to work. And this is a whole system, what we call, in medical terms, we call neuroplasticity, which is your brain learning, basically.
That is very interesting, to be honest. I expected a lot of things, but not this. Not training our brain in any certain way. So how does it affect the brain? I still want to kind of understand that.
So when we take this coil, which is basically the size of your phone, mm-hmm. And it's connected to this machine that generates this magnetic pulses, we put it on the brain, and you will hear a ticking noise and sensation. Not mm-hmm. painful. You're not under anesthesia. It's completely safe, and it's completely painless.
Nice.
So you would sit there. A lot of the times, patients either read a book,
Amazing.
or they're just closing their eyes and just relaxing. And when we send these pulses, it starts to strengthen and builds the connections between the brain cells, mm-hmm. that it starts remembering how it's supposed to behave in the normal way to start getting the condition back to what used to be. Mm-hmm. The easiest way we tend to explain it is this famous researcher scientist called Pavlov. He had his dogs where he mm-hmm. would ring a bell and they would salivate on the ring of the bell. I think a lot of people know this research because they learned it at school. He had dogs and he would ring a bell and he would feed them.
Nice.
And every time he would feed them, he would keep ringing a bell. At some point, he just rang the bell without feeding them. And what he noticed is the dogs just started salivating. They got ready to mm-hmm. eat even though there was no food. And this is the aspect of conditioning. You teach someone a behavior. So every time if I keep clicking my finger, you get stand up, mm-hmm. and I reward you for standing up. The next time I click my finger, you would stand up by default because you're expecting a reward. Yeah. This is what we're doing with the brain, with this machine. Every time I send this mm-hmm. a pulse, it learns how to behave in that way. This is kind of the easy way of explaining it. There's way more complicated.
Well, for a normal patient, this is already complicated. Yeah. I know you're trying your best to make it as understandable as possible. But I think that brings us to side effects. Yeah. I have learned with my conversations with you that most things do have side effects. Yeah. What are the side effects of TMS?
Surprisingly, none.
How?
Zero side effects. The only common side effect that people tend to experience is headaches. Mm-hmm. Is because of this continuous noise they hear, because the magnetic coils next to their head, and it keeps sending these pulsing sensations, and they tend to, because it's noisy, they tend to get a headache after sitting there for like 20 minutes. But nothing a simple painkiller cannot take care of or get rid of. And the more you do the stimulation, you get used to it. Therefore, it doesn't become a hassle or a nuisance anymore. If we're going to talk in terms of medical, what is the side effects? There is a reported warning that potentials of seizures, but this is so low that it's safer than taking medication. You have a higher chance of getting a seizure on any medication than you would on this machine. So we don't even mention it that you would get it anymore, honestly.
What I'm honestly thinking right now is that we have tried to fight psychiatric medication for so long.
Yeah.
You know, there's a lot of myths. We were scared of it.
Yeah.
We grew up knowing it's better to take anything else than those pills, which is definitely not true. How are patients receiving TMS? Are they actually open to it? Are they as scared of it?
Yeah. I think this is one of the most surprising things that we found in this region specifically. Patients would rather do anything than take medication.
That's true.
Which for us, it's a beneficial thing because they're willing to experience this new device. Well, it's not really new. It's been in research since the 80s, and it's been FDA approved and approved by the European medical agencies since 2008. So there's medications that you take today, like antibiotics, that have been approved maybe 2 years ago.
Just recently.
Yeah, and you take them happily without even any concern. But I know the second there's a machine on the brain, people start to freak out a little bit, and they think, oh, what are you going to do to me?
Definitely.
But once we explain it to them, we show them the machine, we give them like a quick demo, they really ease into it. And of course, it takes a little bit of knowing how it helps being in the field to learn human behavior.
Definitely.
And make it a little bit easier for them to take that on.
Exactly. Yeah. I think that's really cool, honestly, and I'm glad there's different ways and different options now for patients these days. So how long does TMS take to work? Is it something they need to be doing for a while?
Yeah. Here's the best thing about TMS. It takes 3 days and then we're done.
That's it?
Yeah.
So as in sessions within those 3 days?
Yeah, you do 10 sessions a day. And and then after 3 days you're done.
That's it.
That's it. So we have patients that had severe depression that have not been treated for years on multiple medications, barely are stable on a mixture of medications. They come in on Sunday, do TMS, walk out Tuesday, no depression at all.
Absolutely fine.
3 days.
So how does that work? 10 sessions a day?
Yeah.
Do they stay in the clinic?
Yeah.
For 3 days?
For 3 days. You don't sleep at the clinic, but you come in the morning at 9 a.m. In the morning, and you stay till 10 or 9 p.m. depending on the sessions. You do 10 sessions a day. Between every session, there's 1 hour break. But you have a room provided to you where you can relax and sit. You can eat something. You can have somebody coming in with you. But I keep telling patients we're in 2024, we understand the brain more than we ever did. We have techniques and tools that help us get to the root of the problem. We don't no longer need medication. Now, I need to explain that medications are not bad. This is not a campaign against medication. It's just we have an alternative option. We have a rapid alternative, and throughout all the years of us working in mental health, the prevalence of mental health conditions have not been improving. Still, patients have mental health conditions, still depression, still with all our best tools. So this is a call that we need better tools, we need different tools, we need faster tools. All other medical fields, you take a medication, you get better in a week. Psychiatry, you take a med, you have to wait at least a month. So
if the medication works
the medication works, and if there's no side effects.
Definitely.
So now we have an alternative, and we really want to have this known to patients that you don't have only one option. Previously, we had one option in terms of biological. Now you have a secondary option, which is a very good option. It's not even like a second line treatment. It's a first line treatment. It's a replacement to your medication.
That is absolutely amazing, and I think, medicine has been advancing, but this is the biggest thing that I've heard of recently. So I truly love that we're able to have that, especially here in Kuwait, with professionals that we do trust in the field. So tell me about the surprising conditions that TMS could actually treat, because you said we can be treated in 3 days. So now I'm thinking, how fast should we be visiting the clinic?
So for one of the surprising cases is that we have patients that have multiple conditions at the same time. So it's very difficult to get someone that, for example, has OCD, but at the same time, because their OCD is so severe, they have anxiety and depression that comes with it. So when you treat them with medication, the medication helps one aspect of their condition, but tends to not help the other. So I remember this one patient that had severe social anxiety, that it came to the position that they could not even communicate with you at all, zero communication. But they also had OCD and they had depression. After we used TMS for 3 days for their OCD went away completely. But the surprising thing is they became so social that when I walked in to ask how they were doing, I was surprised by the person. I could not even recognize the person because I did not expect that person to respond to me in that way. They were very social. They were laughing. They were talking to me in a way that I've known the patient for 2 years, and I've always knew that I went in with questions knowing that the answers would have been a yes or a no through a nod.
Yes.
But there was talking.
You were not even expecting words.
Yeah,
for
yeah,
yes
I was
and no.
surprised. And to me, that just showed me how fascinating this machine is and how fascinating our brains are and how all the conditions are interconnected. It's not a certain region that it has only one thing to do with it. All of the brain is connected, and when we treat one part, the rest get also treated.
I think it's really important to have this machine or device with us right now, because I think the world is going through a wave of awareness when it comes to mental health. Whoever never even thought of going to a psychiatrist is finally going. So it's the perfect timing.
Yeah, we need it now, and it's here.
It's definitely, for sure. So we've spoken before about medication and how sometimes we would need them with other types of therapy. You know, you can't just go to therapy or just have medication on its own.
Yeah.
Does that also apply to TMS? Do we need to do it with other types of therapy too?
Yeah, you should do it with therapy that is behavioral therapy. TMS does not replace cognitive therapy. This is something that you need. This is like physiotherapy when you do an operation on your knee. The physiotherapy does not replace the operation. It's a supportive thing. But TMS replaces the medication or is aiding the medication. Sometimes you have a patient that's taking meds. They feel well, but not 100%. They say, well, we're at the 70% range of improvement. So they would do TMS on top of it to get to that 100%.
Wow.
Or we would get these patients that every time they're doing very well on medications, no side effects, but every time you get them off medication, they relapse. They get the condition back. So what would we do historically with these patients is we tell them you have to live on medications for the rest of your life.
Exactly.
But what we do is we do TMS, and then after TMS, we get them off the medication. So it becomes a fast track option for people that don't want to live on medication for the rest of their life. So 3 types of people that can do it. People that don't want medication as a first line, they do TMS. People that did not improve on medication or have unacceptable side effects can do TMS. Or people that want to get off medication can do TMS. So it's not one size fits all. There's different kind of places where TMS can fit.
So you've mentioned the cases that maybe you've been working with for a while and tried different medications with, for example. So for a new patient that just walks in, would you go through the route of actually recommending one medication and then moving to TMS, or would you just go ahead with TMS right away?
I would give you the option from day one. I did it today in clinic. I had a patient coming in. I told them that they have this condition. I told them that your treatment has to go down 2 paths. The first path is you doing therapy. You have to see a therapist. You have to sit with them, learn about your condition, how to challenge your thoughts and all of that. And then I told them you have the biological path. You have 2. You can take meds, the stereotypical path, or you can do TMS as an option. And when I explained it, they decided to go with TMS, thankfully, because that means I like when patients choose TMS, because I have a bias in TMS because I specialize in it. So there's a bias, but I genuinely see the effects of it, and I see that there's no side effect. And I tell them the worst case that could come out of it is if you don't improve in 3 days, we can go back on meds. The medication is still there in the pharmacy waiting. Nothing would happen. The 3 days that you spend on TMS, the medication still did not even take effect. It takes a month for the medication to work. So do TMS. If it fails, then take them.
We can go back to the classic old route that we're used to. So how long do the positive effects of TMS last?
So if you just do the acute phase of treatment, so just the main sessions, it should last up to 6 months without any issues. But what we do in our clinic, we do something called planned boosters. Is that you used to do it daily, then we slowly make you do it every other week, then every month, just as a slowly kind of tapering off.
Nice.
And this method has been shown that it could last you up to 2 years once you do it. It's a boosters of 6 months, but we get to the last, let's say 4 months, is you do it once a month. And once you're done, it could last up to 2 years. But here's the fantastic thing about TMS is that if you relapse, you come back and you do 1 session.
That's it. You don't have to go through the entire process.
Well, unless you relapse fully and you're not aware and you go back to a severe condition. But once you get better, you understand the symptoms again and you feel bad slowly and you feel that the condition is coming back, you would come in, you would do 1 session. And the good thing about TMS is it's all over the world. So even if you're in a vacation or even if you're moving to another country. So now let's say I have a patient that's moving to another country. You no longer can prescribe to them in that country. You no longer can see them in that country. But if you're doing TMS, they can just go to another country, use the machine there. They get their settings on a documented report. The nurse and the doctor in that new facility will just program the machine, and you're done. So it kind of gives you this freedom as well to kind of to do whatever you want in your life.
It's definitely super easy because I know with a lot of patients, they worry about their prescription, what kind of medication they can take with them to different countries, and what if they ran out or lost their prescription. So it's definitely easier. So what are the success rates of TMS therapy, and how can you actually estimate it? Is it possible to even?
So the success rate, the way we do it is we do two paths. We ask the patient how better they feel, but we do questionnaires. We take you at baseline to see what your scores are, and baseline in terms of depression, anxiety, or whatever condition we're treating. And then we give you the same questionnaires halfway through, and then we give you the questionnaires at the end. And what we tend to see is a trend of your scores going down. So it was in the severe range, slowly getting better to the subclinical range, meaning there's no symptoms anymore. The success of TMS, if we're talking about 3-day protocol, in research, it's up to 90 to 100% response and rate. So most people that do it respond. We've yet to have one patient in our clinic that did not respond to TMS.
I think that's absolutely great. I'm so happy that I got to learn about that this evening, especially with you. You explained it perfectly.
I hope I did.
You really did, to be honest. Like in the beginning, I was like, oh, wow, this is going to take me a minute. But I think I do understand and grasp most of it right now, which is amazing. But do you have any final advice for our viewers?
Final advice is, I guess, that they don't longer have to be scared of psychiatry. They don't have to be scared of medication. They don't have to be scared of seeing a doctor. We have alternative options for you to get treated. Medication is not the only path. There's safer, there's faster, there's better response options. So if you ever go to see a mental health professional, ask them about TMS. Even if they don't have them, ask them, see what they have to say. And I'm sure if they don't have TMS, they can always refer you to a center that does. But there is alternatives, and this is only going to help us get to a point where mental health conditions overall as a prevalence keeps going down in the future, hopefully.
Hopefully. Well, thank you so much for being with us this evening.
Thank you, Rita.
Abdullah.
Thanks for having me. Thanks.
Thank you. Dear viewers, we had with us Dr. Abdullah Habib, Doctor of Psychiatry. And up next, we have a report. Stay tuned for that.